welcome to another new week and another episode of the Anti-Pharmacist podcast. Did you enjoy your weekend? Well, for me, my weekend was very busy. I was doing some research and it took my time, a lot of it actually, but it's all good, right? Today is World Pneumonia Day. Did you even know that something like that exists? Well, that's why I'm here for you. It's World Pneumonia Day, and it's about creating awareness about the disease called pneumonia. A lot of people are not aware of this disease. Oh. A lot of people are not, and they fall victim. It is actually an infectious disease, so it can be transmitted from one person to the other. Okay, let me just go straight into it today without wasting much of your time. So, what is pneumonia? Pneumonia is basically a disease of the airways, majorly the lungs, in which, due to infection, there is buildup of fluid and mucus in the airways, making it difficult to breathe. And that is why it presents with symptoms like cough, breathlessness, or shortness of breath, chest pain, even upon breathing, ordinary breathing, or coughing. Then it could also cause confusion and changes in mental alertness. Okay, the cough may produce phlegm. You know what I mean by phlegm? Those thick, mucousy things could even be colored. It could result to fatigue, to fever, sweating, shaking, chills, lower body temperature than normal, nausea, vomiting, or diarrhea. All of these are symptoms of pneumonia. And pneumonia can either be community acquired or hospital acquired. I mentioned that it is transmittable, it is a communicable disease, it is an infectious disease. So, it is caused by various organisms, many of them actually, but basically bacteria, viruses, even fungi. Okay, the most common bacteria that causes pneumonia is the Streptococcus pneumoniae. There are others like pneumococcus pneumoniae, like Haemophilus influenza. All of these cause pneumonia, and those are just bacteria. They are fungi that cause it, as well as viruses. Okay, and speaking of hospital acquired pneumonia, this is pneumonia acquired from bacteria in the hospital. This could affect caregivers of patients, most especially, or patients that have been in the hospital on the bed for a long time. Having a co patient or a co caregiver around who has this infection could actually pose a risk to this group of people. The hospital has a lot of infections. It is an infectious place. There are many sick people around. So one has to be careful when taking care of loved ones in the hospital. Make sure that you are eating well, you are taking care of your own health so that you do not contract diseases while taking care of others. And also for the sick patients, at least the caregivers, the healthcare providers, they try their best to make sure that they are not immunocompromised and the environment is clean enough and disinfected to prevent nosocomial infections. Then the community acquired pneumonia. This is the one that is not acquired in the hospital. But in the community, you interact with so many people day to day, so you could just contract it. It doesn't have to do with maybe the environment is filled with bacteria or anything. You could just be going on your own, oh, and just encounter somebody with pneumonia or just coughs in your face and you could just get it. So that's the difference basically between hospital acquired and community acquired pneumonia. There is also ventilator associated pneumonia when people who are using ventilators get pneumonia. Then there is aspiration pneumonia, in which you inhale bacteria into your lungs from food, drink, or saliva. It occurs mostly in people who have swallowing problems or who are too sedated from use of medications, alcohol, or drugs when they are eating. Okay. Now to the risk factors. One major risk factor is age. It occurs more in people greater than 65 years and in children less than 2. Well, this has to do majorly with the immaturity of organs and immune system. Okay, immune system of older people diminishes with age, while the ones of children has not developed enough. Okay, another risk factor is immunocompromised patients or people on chemotherapy. You know, immunocompromised patients like people who have human immunodeficiency virus, which is HIV, people using chemotherapeutic agents. You know, this agent fights both normal and abnormal cells, so could kill immune cells at the same time. And of course, in smokers, I talked about smoking last week. If you're a smoker, you're at risk of this infection because it affects the lungs. All right. Poor diet. If you don't eat well, you're not supplying your body with the nutrients it needs to help you fight infections. So you're at risk of contracting pneumonia. So those are majorly the risk factors. Now to prevention tips. Number one, get vaccinated. Did you know that there are vaccines for pneumonia? Take advantage of them. Visit your healthcare provider, ask about this. They will direct you to the right places where you can get vaccinated. I think recently it's been said that most primary healthcare centers are vaccination centers. And in other countries, pharmacies are already designated primary healthcare centers where you can get your vaccines. Well, that has not been implemented in Nigeria, but it could in the nearest future, pending that time. Take advantage of vaccination in healthcare centers. Okay.
And if you have pneumonia, please stay at home, get yourself treated as fast as possible. Do not infect others. Also, if you must go out, use nose mask to avoid leaving droplets all over the atmosphere and infecting others. Okay, be your brother's keeper or your sister's.
And did you know that pneumonia can happen any time of the year, regardless or irrespective of season? Because there are lots of people that believe that pneumonia only happens during rainy season. People even believe that being cold is what pneumonia is all about. No, it's actually an infection. And as long as the infectious organism is in the environment and is transmittable, then people can still get pneumonia regardless of the time of year, okay? Vaccination is the major way to prevent pneumonia. Okay, so take advantage of it. Hand washing is another preventive strategy. Okay, make sure that you wash your hand all the time when you touch a new surface or when you touch people's skin. Use alcohol based hand sanitizers all the time. Of course, it goes without saying that you should also exercise and rest well alongside eating healthy. How does one contract pneumonia? Because it is highly contagious. The most common way to transmit pneumonia is from person to person through inhalation of airborne droplets from either sneeze or cough. But pneumonia can also be contracted from surfaces or objects which are contaminated with the causal microorganisms. You can also get fungal pneumonia from the environment, which is not necessarily spread from person to person. Okay. Then there's something called walking pneumonia. It is a milder case of pneumonia, and people with walking pneumonia may not even know they have pneumonia because their symptoms may feel so mild that they do not suspect they have pneumonia. Walking pneumonia may require a longer recovery period. So, some symptoms of walking pneumonia that are not common include reduced appetite, dry cough that lasts for more than 1 week, chest pain, chills, and the other symptoms of pneumonia. The only treatment option for pneumonia, as you would have guessed, is the use of antibacterial, antifungal, antivirals that would eliminate the major culprit, which is the causal organism of the disease. Some over the counter pain relievers could also help to ease the pain, the fever, and other associated symptoms of the pneumonia. There is high tendency to mix up pneumonia and your common cold or the flu. Okay, so I will just give you about 3 tips on how to differentiate. Okay, number one is congestion. You will feel a kind of congestion alongside chest pain, okay, which usually doesn't happen when you have cold or flu. That chest pain will come with a kind of congestion in your chest, which you feel okay. Another differentiating symptom is coughing up yellow mucus or spit. Okay, it could be yellowish, it could be greenish, it could even be bloody. When you start coughing up blood, please, it's not a small flu, it's not small thing, it's not just any cough. Go to the hospital or go see your pharmacist. Okay, that is usually for bacterial pneumonia. But viral pneumonias, I told you earlier that it can be caused by viruses as well, like the respiratory syncytial virus. That's one of the causative agents. How do you differentiate viral pneumonia from bacterial pneumonia? Apart from those symptoms that I've mentioned, you could experience dry cough, muscle pain. That could be a pointer that what you have is viral pneumonia. Okay.
The best way to know what kind of pneumonia you have is to actually go visit your healthcare provider. They run the necessary tests and let you know what exactly it is you have. It's not all the time that you can know by symptoms. All right?
And that is it for today, guys. I don't have much to say really because, like I told you, I had a very busy weekend and I actually struggled to record this. It's not been easy, but the Lord is my strength, right? Thank you so much. So I hope that you are aware of pneumonia now and you will make commitment to prevent it in yourself, in your elderly ones, in your children. Okay, it is no joke. It can be life threatening even. And I hope that you have nothing to do with it. Okay. Thank you so much for listening up to this point. At this point, then, please, I don't know how else I will say it, that I need you to make comments on this podcast. Don't just listen. Don't just like posts on LinkedIn, on Instagram, and leave it at that. Actually, click those links, listen to the end, make your comments, subscribe to the podcast, share. Just take those steps as I've mentioned it. You're happy? I'm happy. Okay, please help the podcast. I really, really need the engagement for more visibility. God bless you as you do so. Okay, and like I told you, the feedbacks help me to know what people like, to know what direction the show should go. Okay, the show is not a rigid one, it is quite flexible, guys. Thank you so much, so much for your support so far. Till next time, stay healthy and God bless you. Have a nice week.